You were watching a chunk of hospital roof blow off during the height of Hurricane Ida. This happened at the Lady of C General Hospital in Lafourche Parish. But many hospitals in that region were already full with COVID patients, and the stress of caring for them is taking a toll. A survey during the pandemic found that 62% of intensive care nurses are burned out. Now we're seeing the long-term impact of that burnout. Senior medical correspondent Dr. Tara Narula spoke to ICU nurses who have left their frontline jobs or dropped out of the profession entirely. Tara, good morning.
Good morning, Tony. The nurses we spoke to said both the number of hours they work and the number of patients they're responsible for have them feeling depleted and under-resourced. For many, it's about preserving quality of life and maintaining a workplace environment where they can give patients the attention they need.
Here.
Spending early mornings at home is a new part of Paulette Rangel's workday routine. For 7 years, she worked overnights as an ICU nurse at a level 1 trauma center in Phoenix. When COVID came calling last year, Rangel and her co-workers stepped up.
Some nurses were working 4, 5, 6 days a week, 12-hour shifts. You felt guilty for wanting to call off because you knew that you were going to leave your co-workers behind and they would have to pick up the slack.
Rangel says her training gave her the skills to respond to a pandemic, but did not prepare her for the emotional toll.
When you are working 12 hours straight in these high stress, high adrenaline situations, it takes a lot out of you. We wanted to be there for our patients, but when we're running on fumes, it's hard to do that.
Back home after her shifts, Rangel's distress was obvious.
I would just come home and I would go straight to my room. The kids weren't allowed in there and I wasn't touching them. Talking to my husband, I was just telling him, I really don't want to get you guys sick.
So we have those.
After trying counseling and antidepressants, Rangel switched to a job in community health, seeing healthier patients during daytime hours.
The problems that we see in nursing now are not new. It's that high level that we had before COVID that's made it just really out of hand now.
Linda Aiken teaches and studies nursing at the University of Pennsylvania.
We have a robust supply of nurses. The problem is that we don't have enough funded, permanent, full-time positions for nurses in the settings where they're needed, namely hospitals, nursing homes, and schools.
There are no federal limits on patient-to-nurse ratios. California is the only state that has set minimum staffing standards. Aiken says the workload varies widely, with nurses in some hospitals caring for as many as 10 patients.
Nurses make the difference in whether patients live or not. Every patient added to a nurse's workload is associated with a 7% increase in the odds a patient will die just after common surgical procedures.
In the early months of the pandemic, Christopher Hayes hit the road as a travel nurse to help staffing shortages at hospitals overwhelmed with COVID patients.
What is it that really wore you down the most during the pandemic?
Getting used to the amount of people that were dying from COVID and then talking to their family members after they died.
As Hayes rotated through 4 hospitals in Texas and Oklahoma, he saw a pattern.
People just still honestly do not understand how severe this is, how bad staffing for nursing is. I have to take care of myself first before I can take care of someone else.
Hayes is now taking a break from nursing to recharge. Back home in Little Rock, Arkansas, he opened a CBD store, hoping to heal people in a different way. While they welcome acts of gratitude, nurses say what they really need from administrators are reinforcements.
When times are tough and things are getting rough, they'll have a pizza party. You guys are spread really, really thin and we can't get new nurses, but here's pizza.
Would you ever consider going back to the hospital and taking that kind of a job after the pandemic is over?
I would definitely go back.
Aiken believes hiring more full-time nurses pays for itself through savings from fewer infections, shorter lengths of stay, fewer patients readmitted after discharge, and avoiding paying a premium for travel nurses at peak times. She told us healthcare is about people taking care of people. Nurses just want a sense of joy and accomplishment and to not worry that they couldn't give enough time to to their patients.
I mean, more nurses will pay for itself economically, as you just point out, but in terms of lives saved, it'll also pay for itself. Just incalculable. Tara, thank you very much.